Good afternoon. I am Tiffany Hester, the Director of Community Benefits at Titus Regional, and I want to thank you for joining me today for the Titus Regional Medical Center Community Update. We have a lot of great things going on, so we're going to jump right in to July. And tomorrow, July 11th, in our hospital lobby, we invite you to join us for the Da Vinci Robot Demo Day. We have our surgical robot in our lobby. You can join us for a hands-on experience, operate the robot, talk to our surgical team, ask them questions. The representatives from Intuitive will be on site. They'll also answer questions about this surgical technology that we have here and is bringing a new level of care to Titus Regional. With this surgical robot, we have smaller incisions, faster recovery. Come by, bring your kids. They can operate it. Let those little future surgeons get their hands on the robot. But again, come by the lobby tomorrow from 11 to 2 and enjoy this wonderful technology and all it has to offer. And something fun with our robot, we're trying to name it, and so we would like your input. You can go to our Facebook page, and we have a link there, or we'll put it in this chat to this broadcast. We have 4 names on the block. They are Leo, Sergio, Vinny, or Sunny, and we want you to participate and help name our robot. So again, help us out, and we look forward to seeing you tomorrow from July 11th from 11 to 2. Next, we have 2 new members to the Titus Regional Medical Center team, and the first one I'd like to introduce you to is Dr. Marcus Smith. Dr. Smith is a board-certified neurosurgeon, and he is bringing spine care to Titus Regional. This is special because he will be the first surgeon to do spine surgery here at Titus, and that is giving us advanced care right here at home where you're not having to travel. So if you are interested in finding out more about Dr. Smith and the services he has to offer, you can go to our website or you can call his office. He is already accepting appointments and will begin seeing patients in just about a week. And his telephone number is 903-577-6290, and we'll have that in the chat as well. Next is a familiar face that we're bringing back to Titus, and this is Dr. Mohammed Al-Farwadi. And Dr. Al-Farwadi was with us during the COVID-19 pandemic, and he was a tremendous asset to us then, and we are so excited that he is coming back to Titus to bring pulmonary care to our community. Dr. Al-Farwadi will take care of all your pulmonary issues. If you need to make an appointment with him or would like to find out more about him, we're accepting appointments for his clinic, the Pulmonary Care at Titus, and his telephone number is 903-434-4826. So that, again, we'll place in the chat, or go to titusregional.com. Dr. Al-Farwadi and Dr. Smith will have bios on there along with all of our other physicians and providers, and you can find out all the information you want to know about the Titus team. Now, at the end of June, we had our baby fair, and that is the most fun and such a great time. And we had new mothers and expectant mothers and their families. They joined us in our lobby, and our labor and delivery staff was there. They answered questions. They gave demonstrations. We had other vendors that had the latest and greatest baby fare there. We had safety demonstrations as well, and it was a wonderful time. It was a great way for new and expectant mothers to connect and get all the up-to-date information regarding their precious babies. And so As a team leading up to the baby fair, I really want to thank the Titus team and congratulate them on something wonderful. We had a diaper drive internally in the hospital, and we were able to raise enough money to buy over 5,000 packs of baby diapers. And we have donated those to Heart Pregnancy Resource Center and Tri-Lakes Pregnancy Centers. Both wonderful organizations, and we are thrilled to be able to donate that. So thank you, team, for participating in that. And still dealing with our babies, I want to talk to you about anybody who's had a new baby. We have a postpartum mommy check-in, and they are meeting July 17th from 6 to 7 in the Hospital Williams Conference Room. That's a chance for you mothers to get together, talk about things that are working, struggles, joys, but it's a good time for you to get together and support each other. So please, if you're a new mom and are interested, join us on July 17th as well. I'd also like to introduce you to Stephanie Hill. Stephanie is a longtime trainer at Titus Fit in our Wellness Center, and she has taken on the position as manager of Titus Fit, and we are excited. She has plans. She wants to bring exciting new classes and things to our gym, and we want you to be a member of our gym. So stop by Titus Fit. Stephanie's there to talk to you. You can also check out the Titus Regional webpage. We'll start updating that with new classes, wellness and health tips that you can look into. So thank you, Stephanie, for taking on this job, and we are excited to see what the upcoming fun things you have planned for the Wellness Center. Lunch and Learn. We usually take a break from Lunch and Learn in July and August, but so many things are going on at Titus that we are having a Lunch and Learn in August, on August 13th specifically, from 12 to 1 at the Civic Center. Again, Lunch and Learn is for our over 55 community, and it's a chance for us to get together and talk. We will have some time where we will give you updates on the hospital. You're an important voice for our hospital, so we want to sit down and talk to you. And Dr. Smith is going to be our guest speaker as well, and he's going to talk to us about spine care and the services he can offer to get us back walking and feeling better with advanced spine care. So we are already jumping right back into Lunch and Learn for August. And again, it's on August 13th from 12 to 1 at the Civic Center. And if I talk about Lunch and Learn, you know I need to talk about Coffee Chat. Coffee Chat is our community forum. We meet the first and third Wednesday of each month from 9 to 10 at Huey's Coffee. And this is a time for you to sit down with the patient experience team and executive leadership, casually enjoy a cup of coffee and ask questions. Ask what our plans are, what we're doing. If you have concerns, let us know those. We are open. There is nothing that is not talked about at Coffee Chat. It's a way that we can learn and do better for the community. So please join us the first and third Wednesday of each month. And next Wednesday is another Coffee Chat. We'll be there from 9 to 10. I want to personally thank Huey's for continuing to allow us to have this open forum in their lobby. It is a great thing that they do for us, and we are very appreciative. Now, before I end today's broadcast, I always like to give you a little health tip, and I want to talk to you about summer. July specifically is UV Safety Awareness Month, and the sun is blazing in July, and we all need to protect our skin. And so you hear about wearing sunscreen, and I'm going to say it again. If you're going to be outside for any extended period of time, please wear sunscreen, and it's suggested that you wear an SPF of 30. Protect your skin from those harmful UV rays. We know that the UV rays are associated with skin cancer, but they're also related to heat-related illnesses. And with that, I want to talk to you about the possibility of heat stroke. Temperatures are soaring, and the heat stroke possibility is rising as well. And so I want to give you a few tips about that and what you can watch for. And if you're going to be outside in the sun and in the heat for any time, you need to be paying attention. And if your body heat gets to 103 or higher, you are at risk for a heat stroke. And things that you can watch for in yourself and others is hot red skin. It can be damp or it can be dry. And so if somebody is becoming extremely flushed, pay attention to that. You'll also can have an increased heart rate, get that rapid pulse. A lot of people experience headaches or nausea or dizziness. Also fainting. If you have any of those symptoms, heat stroke is a medical emergency and you need to get taken care of quickly. Things that you can do to help prevent from having a heat stroke. One, stay hydrated. Drink water. Even when you don't feel thirsty, continue to drink throughout the day. Wear lightweight clothing that's breathable and loose fitting. Avoid strenuous activity in the hottest part of the days. Do your yard work early in the morning or later in the evening, but try to stay out of the hottest part of the day. You need to take frequent breaks when you're outside, either exercising, playing golf, tennis, pickleball, whatever you're choosing to do. Take those breaks, get into the shade, go cool off, and do that frequently. And most importantly, please never leave a child or pet in a car, even if you just think it's to run right back in the house and right back out. Temperatures in cars rise very quickly and they can be lethal. So don't even chance it for a minute. So remove your pets and your children from your cars. If you think you are experiencing a heat stroke or someone you know is experiencing a heat stroke, please dial 911. It is an emergency and we want you to stay safe. Watch out for your friends and family as well. We want to enjoy this summer and we want you to stay cool. That is it for the community update. I appreciate you joining me. Please don't forget to join us tomorrow from 11 to 2 in the hospital lobby and get your hands on that robot. And don't forget to help us name him. Have a great day.